very angry husband storming into my clinic one day and saying, ये कोई तरीका होता है, मीटिंग में हूँ और मेरी बीवी फोन करके बोलती है मेरा ओव्यूलेशन टेस्ट पॉजिटिव आया है, आप अभी आ जाओ घर पे. We have to do it right now, otherwise my eggs will die off. Well, it might sound very funny. However, to a couple who's struggling to get pregnant, this is very important. To time the perfect period to have sex to have a pregnancy, so that a pregnancy can happen, comes very easy to most of the couples. But to some, it is not so easy. To understand this, we have to understand how a pregnancy happens. Women have two grape-like structures called ovaries and two tube-like structures called fallopian tubes on either side of the uterus or the womb. As soon as the period starts, there are tiny eggs which starts growing in each ovary. One of them in one ovary will grow bigger and larger in size than the rest of the others, and when it reaches a certain size, it pops out of the ovary. Immediately is taken up by the fingers of the tubes, and it waits in the tube for the sperms or the swimmers to come in. Or if the sperms of the swimmers from the partner is already present, intercourse that has happened 1 or 2 days before, then the first baby is formed there in the tube. And then 3 to 4 days later, slowly the baby comes down, gets hooked to the lining of the womb and start growing. This is the time when a pregnancy test becomes positive.
So today I'm going to demyth 6 of the most common pregnancy myths. Number 1 being, you cannot travel during pregnancy. For all of the 9 months you have to be stationary, stagnant, don't leave the city. No, no, no. If your gynaec has told you that your pregnancy is not high risk, you don't have any of the high risk factors like bleeding, like a low-lying placenta, or any other complication which your gynaec will talk to you about, you can travel. You can even fly. So talk to your doctor, and if she allows you to travel, it's absolutely safe. The second myth being, ECLIPSE में बाहर मत निकालना. Your child will have a deformity. So सूर्य ग्रहण हो या चंद्र ग्रहण हो, you can tell all your dadi maas and nani maas to relax, because that is not true. If you're superstitious and you don't want to do it, that's completely your call. But scientifically and evidence-based, nothing's going to happen to your baby. So be rest assured and do what you have to do. The third being, eating pineapple and papaya are going to cause an abortion? Well, no. Even though these fruits have a certain amount of estrogen level, research shows it cannot lead to an abortion or preterm labor. But then again, because it does have estrogen content, if you want to give it a skip, it's perfectly your call. The fourth one, which you will be excited to know, you cannot have sex during pregnancy. You can. Yet again, there are different types of complications in pregnancy. If you have one of those and your doctor has asked you not to have sex, then refrain. But otherwise, other than the first initial few weeks where the implantation is happening, after that, sex during your pregnancy is absolutely and totally fine. So now coming to the fifth one, something which is very important for us Indians. The woman is often blamed for a baby which is a girl. So a woman is blamed for having a girl child. I don't even want to get into that conversation about how bad it is, but for the information, for the record, a boy child comes from an XY chromosome and a girl from an XX. A woman only has X chromosomes. So what I'm trying to say here is, whether it's going to be a girl or a boy comes from the genetics of the male partner, the husband. So next time you're blamed, your sasuma or your husband is trying to tell you, Beti is your fault, firstly fight for it, and secondly tell that it's not your fault. And then of course, coming to the sixth point, that you always have to eat for two, not necessary. So depending on your BMI and the amount of work you do, your doctor is going to tell you the extra amount of calories that you need. So you don't need to go on putting on weight. If you are a normal BMI, you only have to put on around 11 to 12 kgs in 9 months. So stop hogging unnecessarily, eat how much ever you want to. And another very important fact, morning sickness doesn't always happen in the morning. So if you're facing some kind of nausea or vomiting during the evening or night, it's perfectly normal. If it's hindering your food habits or it's making you really weak, go and show your gynecologist. Happy pregnancy!
Subscribe to the YouTube channel and don't forget to hit the bell icon so that you don't miss any videos by us.